So when we were having lunch upstairs and you guys were chatting down here, I was amazed by how dominated our conversation was by AI and social media. So you just mentioned social connections, how important, but real social connections, right? How are you navigating the whole new world as doctors?
In terms of social media?
In terms of your patients going, hey,
I read this on ChatGPT.
ChatGPT told me I have
to get
this.
pellets.
So number one is to be aware of what my patients are looking at. And I have stayed off of social media, but kind of had to get on because my teenager went on it. And so I kind of watch and see what's out there. I just went to a conference and someone was saying that they chat GPT what's the newest on menopause in social media. I'm like, ooh, that's kind of cool to know. I look at evidence-based, and I'll tell people in the office, look, I'm not going to sell you a supplement. I'm not here to sell you products. I'm not selling you testing. I have no financial gain other than giving you the information that I know is up to date.
Dr. Diggs?
And part of being a sounding board, when, as the first pass oftentimes before I refer to a specialist, is knowing what people are hearing. And because I get to talk to so many women and patients at different ages, it's very interesting. I've got certain patients who will bring me cut out newspaper articles, right, and say, did you read this? And I say, I haven't had a printed newspaper in my house since, but I love it. And then others will, send me a MyChart message with what they saw on TikTok, right? And so being able to know where people are getting their information and validate that there is, because of some of the lack of trust and openness and access, people have sought out information from wherever they can get it. And some of that information is great and some of it's baloney, right? And my job is to help navigate. And if I don't know, then I depend on specialists and say, I'm going to go and look and read about this. But the evidence-based stuff, it's simple, but it's not easy. So all those things I just said, diet, exercise, sleep, stress reduction, they sound easy, right? We can just burn it off the tongue, but I just told you I can't get to the gym. It's hard. So recognizing that people are getting lots and lots of information from their friends, from social media, from whatnot, and then helping to be a filter of, for you in context of your life, where does that fit? We joked, I've got women who come to my clinic saying, well, do I have menopause? Do I have perimenopause? And I said, do you have any symptoms? Are you concerned? No, but my friends all do. It's and I said, great, I cured you, and you didn't have, nothing was wrong. And so some of it is just validating that we're hearing it so much that we almost feel like, well, if I'm not having those symptoms, something must be wrong with me. And no, lucky you. You're doing great.
Comes down to communication, right? And talking with people and doctors.
And I was going to say, not being dismissive. There's a lot we don't know. Yeah. And I tell women all the time, hey, this is the information I know on this day and this time. 10 years from now, this could be different. It's important to hear. And, having done this for over 20 years, I remember when the WHI study came out in 2002. I remember the next day, all of the phones going off and our messaging completely being flipped overnight. And I think there's a lot of lessons to be learned from that, listening and hearing. And sometimes, like you said, it's just a matter of just listening, and that's all you need. That's all they need.
I think,
go ahead.
To echo on what Dr. Vasavada talked about, so I trained just 5 years phase shifted after the Women's Health Initiative study, and it was essentially all hormones bad forever, right? And the pendulum swung so far the other direction. And it really wasn't until the last 5 years where I said, well, that's not true. And so I brought the hormone into my own practice and I'm much more comfortable with them. But my entire training in internal medicine was just none, zero, bad, and that's it. So having humility and why the foundation, why it's important to emphasize research and clinical care is so that we can confidently answer these questions, not just for us, but for our daughters and our granddaughters for many, for many years to come. So it takes research dollars, it takes science to really be able to give the best advice to our patients, and that takes funding. And so and as Dr. Waco said at the beginning, women's health has been chronically underfunded, and so being amongst women who recognize the importance of that and see the value, even in our small community here, of how that impacts our own lives and our families' lives, I think is really inspiring.